All right, everyone. Thank you for joining Anteater Insider Live. I'm your host, Aaron Orlowski from UCI's Office of Strategic Communications and Public Affairs. This is the live show produced by our office here for staff and faculty to discuss some of the most important elements of the re-engagement of campus operations in this COVID-19 era. There's so much important information that we really want to share, and so we're glad that you're here to tune in and listen to it. Today, we're focusing on the COVID-19 reporting process. So hopefully this is something that none of us have to do, but if you are infected with COVID-19 or you think you are, what happens next? What do you do? Who do you need to contact? And then at that point, what happens after that? What does UCI do with that information? And what is UCI doing to prevent the further spread of the virus? So today we're going to hear about that process, and we're going to hear from a couple guests. First, we're going to have on Bob Martin, who is a Senior Director of Performance Excellence with UCI's Human Resources Office. And then we're also going to have David Souleles, who is the Director of the COVID-19 Response Team here at UCI, and he's the former Deputy Agency Director of Orange County Healthcare Agency. So first we'll hear from Bob, and he'll present about that COVID-19 reporting process, and we'll take some questions through a Q&A portion. And feel free to submit your questions through the Q&A feature at the bottom of your screen. Please, when you do submit those questions, make sure to keep it concise, and you can also upvote some of your favorite questions if you want to get those answered. And then after we hear from Bob, we'll hear from David, and he'll present for a few minutes and then also do a short Q&A. So the last thing that I want to say is that this webcast is being recorded, and so we'll post it to YouTube after the fact. So if you jump in late, or if you have to hop off early, or you want to share the webcast with any of your colleagues, we'll be sharing that link out so you can do that. All right, Bob, thank you so much for joining us as a guest today on Anteater Insider Live. We're really excited, and the floor is yours.
Thank you so much, Aaron. I'm very excited to be here as well. You can go ahead and go to my first slide. Oh, there it is. So as Aaron mentioned, my name is Bob Martin. I'm the Senior Director of Performance Excellence. I work for the Associate Chancellor and Chief Human Resources Executive, Ramona Aguilar. I'm not going to spend too much time on my bio, but let you know I've spent the last 20 years involved in project management and Lean and Six Sigma methodologies, assessment, and organizational development. I'm a Six Sigma Black Belt. I've got a doctorate in psychology with a focus on organizational management and consulting. And today I'm going to be focused on talking about how to submit COVID cases for students, staff, faculty, and academics. Go ahead and go to the next slide. So before I talk about that, I wanted to give you a little bit of context because there's always ever-changing information which is coming from the county. If you look at the blue bars there, and again, I mentioned this is from the Orange County website, all of the different hospitals in the region report all of the case information to them. The blue bars there are the daily case reporting. The little black segments in between are typically the weekends. And the yellow line is the 7-day moving average. It's very easy to tell when you're looking at this that Orange County peaked cases around mid-July. And it's been coming down slowly, but not as quickly as it ramped up in the beginning. And we believe that due to masking and hand washing, people are doing a pretty good job of social distancing and limiting mixing between households due to some of the regulations that have come out from the governor and from local state and county. And also it's possible that the weather, the humidity and the heat may actually be helping as well. However, we all have to be very careful and cognizant of the fact that there are some models that are predicting that we could have a surge as we're approaching the flu season, maybe 4 to 6 weeks after school starts. And as we're getting better and guidelines start relaxing, it may very well be that we're going to be in this type of situation or possibly even worse. So we have to be careful of that. Next slide. And I also want to share this as well. There was some confusion because a while ago, we were taken off the governor's watch list. The whole goal was that our positivity rate got to about 8%. And the system completely changed a little while ago. I think maybe about 6 weeks ago. I might be wrong about the date. But it was the system changed to this blueprint for a safer economy which takes a look at the county risk level and new cases and positive tests in order to incorporate some new learning. There was a lot of knowledge. There was a realization from the scientists that the biggest risk of transmission is from indoors. And that's why you saw a lot of changes to capacity and et cetera, for whether it's at church or whether it's at school or at the local barbershop. So we have recently gone from widespread down to the red tier, substantial. And these numbers are from last Friday, so I think they're even lower now. But we're quickly approaching the possibility of going to a moderate tier. Now, keep in mind, what that means is that businesses will be allowed to expand more, and they'll be able to to have things like indoor dining. There's actually some restaurants already that have indoor dining in Orange County as well. With that comes more risk. It takes a couple weeks to move from each tier to the next tier, but it's very, very easy to go back, right? So even though we're doing better and this, things are going to be opening up, we could indeed have more cases coming this fall. Next slide. So I want to talk about how to actually submit a case. There's been some confusion on campus because we have case submitting for students and student workers, and then we have case submitting for staff and faculty and academics, and they're a little bit different. But I'll tell you, and the most important message I can say with this is, if you've got any questions, you have a process question on how to report a COVID case, we have an amazing team. They actually work for HR. It's the COVID Response Center. The extension is 49918 or just 9918, and there's a number there as well. Any process-related questions, the team is there to help you. If you already, otherwise, there are some direct links that you can go. If you already know how to do it and you have a case, there's direct links we're going to go, and I'm going to be talking about each one of those as well. Next slide. So as far as how individuals should report a case, in the next two slides are going to be focused on students and staff and faculty. One thing I will say, a criteria for reporting on the top, in the first bullet, this really applies if you're staff and faculty or if you're an employee. We just want to emphasize that there's no need to submit a case if you've been a remote worker, you've been remote working for a couple months and you come down with symptoms and et cetera, and maybe you went to your doctor, you tested positive. You don't need to report that, right? The most important thing is that we're trying to track this and look for patterns for reporting that's on site. And Dave will talk more about case investigation and contact tracing as well. But if you or one of your employees has a lab confirmed case, right, so you know you're positive, or maybe you use the daily symptom checker and you click yes on that because maybe you have symptoms, or you've already been to the doctor and you have a pending test result, or you had a direct exposure with a confirmed COVID positive individual. And at UCI, the definition for that is either physical contact or close contact. In close contact, the criteria is actually, more than 15 minutes, less than 6 feet, and UCI specifically, one or more of the individuals is unmasked. So that's the criteria we're using to actually report a case. As far as the steps go, although there is a little bit different for students, different process for students and for staff, faculty, and academics, what's universal is, do not go to work, do not go to class, don't go anywhere else on campus. If you're a student, please stay in your living unit if you do meet that criteria. Also, immediately inform your supervisor, or in the case of, it might be a department chair or most accessible official, such as a PI, if you're working in research or resident advisor, et cetera. And of course, please seek medical advice through your primary care provider as well. Next slide. So if you're a student and a student worker, Dr. Albert Chang from the Student Health Center recommends that students actually contact the Student Health Center themselves. Now, they will take a case from a supervisor, et cetera, but it's always better, and it's their preferred best practice method for a student to call the Student Health Center directly. One method is to call their number. Another method is to go onto their website, and they've got it's almost like the symptom checkers that most people are getting, where you click on your symptoms, and then it'll give you instructions. And the instructions are going to be the same. They're going to tell you to call the Student Health Center. They also give you some recommendations of self-isolate, et cetera. It's a very simple process. And by the way, this applies to all students. Whether you're a student or a student worker or a graduate, or student researcher or graduate researcher, this applies to you. All students should go to the Student Health Center. Next slide. Now, if you're staff and faculty or academics, so this is basically everybody else, and keep in mind for those of you listening from the Med Center, that's a totally separate process. We're not talking about the Orange Medical Center. They have their own process working with occupational health. So this is for campus, staff and faculty and academics. There's a website that you see, and you can see on there that there's 3 different steps. Step 1 is a report, step 2 is respond, step 3 is return. So really, for those who are submitting cases, the most important one is the report process. There's some instructions on there. Obviously, don't go to work, inform your supervisor, seek medical advice. And depending on the department, either the individual or the supervisor or the local departmental HR will submit an actual form. And the form is intended to capture information about whether or not you have a suspected or confirmed case, when you were last on site, when you had symptoms, where you went to on site, and maybe who you potentially exposed. So there's a form that you fill out, and it goes to the folks that are on step 2 respond right there. Departmental HR gets the information because they may have to coordinate leave documentation. There may be some workers' comp if it's applicable. The supervisor will need to work with environmental health and safety in order to see if there's possibly decontamination strategy. COEH will evaluate the symptoms and assess potential exposures. And COEH, by the way, is the Center for Occupational Environmental Health. So these are clinicians that will call the individual and talk to them, and then also do case investigations. And Dave will talk a little bit more about the contact tracing as well. And then central HR does tracking and looking for trends and patterns, et cetera. And the one thing, because there's been a little bit of confusion, and I'm not going to spend too much time on the return phase, but as an individual, if you were placed off work, you will need to provide your medical clearance documentation, which may have come from your primary care provider or might have come from COEH as well. So I just wanted to share that little piece. And we wanted to provide a little bit of guidance for supervisors as well. Basically, if you don't know what to do, call that number, the 49918 or 9918 number. That's the number. They can help you with all of your information. If you have case-specific related questions and you supervise students, contact the Student Health Center. If you supervise staff, you can contact COEH. Don't close your spaces or send other staff home until you've called either the Student Health Center or COEH, because there has been some mixed instructions in the past about that, but that is the process. However, after hours or on the weekends, if you find out about this, you've got a lab, it's 11 o'clock at night on a Friday, yes, you can close spaces and send staff home, and then just call COEH or SHC as applicable on the first business hour opportunity. You should also contact EH&S to discuss a potential decontamination strategy. It may or may not be applicable, but they have their methods to be able to determine whether it is. And please keep your local HR informed as well, because they can help you with this as well. And supervisors, make sure, and this applies to everybody, if you hear any information about names or anything else, please do not share the individual's name with anyone except for the departmental HR or central HR or Student Health Center, COEH, as applicable. The individual's illness is individually identifiable health information, and so it cannot be shared, right? These are patients. You might be an employee, you might be a student, but you're also a patient when it comes to reporting. And lastly, I got this from Dr. Huang. She's from the occupational health, she's from infection prevention from the medical center. And I love this sort of cheesy metaphor, pardon my pun, but she recommends that, look, we all have imperfect behaviors. So imagine universal masking as one of these little cheese wedges. Imagine hand hygiene as another one, social distancing as another one, staying home when you're ill as another one, right? Each of these has potential flaws, but when you line them all up together, your chances of COVID transmission diminishes tremendously. So again, multiple barriers can protect you. Don't just wear a mask or just do hand hygiene. You need to stack all of these potential defenses to reduce the transmission. And that's what you can do as an individual to help slow the spread.
Well, thank you, Bob, for presenting and sharing all of that information with us. We really, appreciated it. So if the audience has any questions here, please feel free to drop those into the Q&A. But I guess I'll start with, one of the questions that I had to begin with. So in a lot of ways, we've all been receiving these emails about the daily symptom check, or, maybe you're using the app to do that. And so, it seems like that's kind of the first step in the process. So why is that so important to participate in that process?
Yeah, the daily symptom check app that you're talking about, and either through email or there's an app, there's several different ways to access it. One thing that I like is that it promotes self-accountability, right? There's another important thing is maybe I'm not, I've been fine this whole time for a month, but maybe, right, this morning, I'm not feeling so good, right? And I don't know what to do, but I remember the app. And as soon as I go through it, it's going to provide you just-in-time instructions. It's going to tell you exactly who you need to call. And that maybe you didn't keep that information before. Maybe you didn't write it down from this podcast, but you'll have it when you use the app. And also, this is a requirement, right? So we are following guidelines from the state and county, and we do need to have anybody who's going to be on UCI property needs to do some sort of monitoring. At the medical center, you walk in and they're checking your temperature and they're using a different version of the app. On the campus, we have the different versions of the symptom checker apps.
Great, thank you for that. And then one more question that I wanted to ask here. So if I report, my case of COVID-19, does that go in my HR file? Does that affect my job in any way?
No, absolutely no. All of the responses are monitored for the sole purpose of making sure that the employee, right, who is now a patient in this case, is connected to the proper resources. Again, as I mentioned before, the individual's illness is individually identifiable health information, and it is protected. Additionally, with the symptom checker app, all of that information, the yes responses, et cetera, are all deleted after a 30-day period.
Great. Well, thank you for that, Bob. So if any other questions come from the audience, please feel free to drop those in the Q&A. But for now, let's move on to David. So David Souleles is, like I said earlier, the director of the COVID-19 response team here at UCI. And, David's actually an alumnus of UCI and shared with me earlier that his first job after graduation was here at UCI. So, in a lot of ways, welcome home. We're really glad to have you here on the show. And let me pull up your slides and you can take it away.
Great. Thanks, Aaron. I appreciate that. And good afternoon to everybody today. So looking to build upon what Bob has talked about, I was brought on board just about 6 weeks ago now to head up COVID-19 response, and in particular to get a contact tracing program up and running here at UCI. Here in the program in public health, where I'm housed, our dean, Dr. Bernadette Bowden-Albala, really has been one of the main leaders working with the rest of the county, the university leadership to really build out the response program here at UC Irvine. And really one of the key components of this response program is our contact tracing. As Bob mentioned, there are a number of things that we ask people to do in order to help us protect our community, keep people safe, break the chain of infection, because really this is all about stopping the spread of COVID-19 so that we can get back to our business of education and research, right? We get back to a little bit more in-person activity, in-person education, in-person research. So Our goal here is really all about getting us back to our core business here at the university. So, as Bob mentioned, daily symptom checking is critical. Staying home when you're ill is really one of the first line things that you can do as an employee to help us reduce the spread. When you're on campus, when you're out in the community, wearing a face covering and wearing it consistently is really critical for us. Doing that physical distancing is also important. All of these things build upon each other and help to support preventing the spread of COVID-19. Good hand hygiene, critical. Washing your hands, using hand sanitizer, sanitizing down your workspaces on a regular basis, and all of the other institutional efforts we put into place for cleaning and maintenance of our buildings, etc. And then the tool we're really bringing online now, coming into the fall quarter, is contact tracing, which very simply means taking the call from contact tracers who are UCI students and employees who are employed by the contact tracing program to really reach out to individual cases and close contacts of cases so that we can understand where exposures may have occurred, and we can also, in talking with the case, identify who may be close contacts and who needs to then take particular actions. So again, our goal is, as quickly as we become aware of a case, to be able to interview that individual, identify exposure locations, as I said, identify close contacts, and then reach out to those close contacts. For individuals who are cases, they will be asked to isolate, and they'll be provided instructions on how to do that, either in their homes, or if they happen to be students here on campus, isolating in the residence halls through procedures we've set up. If you're a close contact but not sick, we're going to ask you to stay home for 14 days and monitor your health and get tested at about day 7 so that we can assure that you have not become infected. One of the things we've learned about COVID-19 is you can become infectious before you have symptoms, and many people may be COVID-19 positive but never actually have any symptoms. I will say that contact tracing is typically a function of county public health departments here in California. Obviously, with such a high volume of cases in California, we have worked very closely with the county health department to look at how we can be value added and really do that contact tracing function for our campus population to assure that we create as safe an environment here at the university and on our properties as possible by identifying cases, getting people isolated who are cases, and quarantining those who may be close contacts. As we've talked about, as Bob talked about, screening is an important part of this. If you indicate a symptom on the symptom checker and in consultation with COEH, you are sent for testing, we would then, if you are positive, have that information referred to the contact tracing team, who would be calling you to go through a series of interview questions, really to elicit the information that we need to assure that we identify your close contacts, identify places you might have been where others might have been so we can reach out to them as well. And also provide you with instructions on what you need to do, assure that you've got the resources you need in place to be able to isolate or to quarantine. These interviews will go into a lot of information, and I think, as we've said at the front end, our goal is to protect the confidentiality of your information and to use it only as necessary for the public health protection measures that we need to take to assure the health and safety of our community. We will be working in close contact, in daily contact with the Orange County Healthcare Agency to manage our cases here on campus and our contact investigations. As you can see from the slide that's up here, one of the reasons contact tracing is so important and doing it as quickly as possible after a case has been identified is that the approximate time between somebody becoming infected and somebody showing symptoms is about 5 days. And the amount of time that you can be infectious can begin before symptoms is about 2 days. So we have just a little bit of time to really get in there, get the information we need, get people isolated who are cases, get contacts who may have been exposed into quarantine, all towards the end of breaking the chain of infection. And if we go to the next slide, you'll see just really a visual, the idea, and we've seen this play out across the country. COVID spreads very quickly through communities if we don't take any steps to break the chain. And we've got the opportunity in between every case to be able to stop the chain of infection through effective isolation and quarantine. And again, really trying to identify those areas and locations that might have been locations where others were exposed so that we can reach out and identify additional cases and quarantine individuals who might have otherwise been exposed. Go to the next slide. So our contact tracing program, as I said, we will be hiring 2 full-time managers to manage the contact tracing program. 1 is already on board. We will be using graduate students who are DTEI fellows who have been trained in a workshop that was offered by the Program in Public Health over the summer on contact tracing. We'll also be using other employees who will be brought on to do contact tracing for us. And our public health faculty will continue iterative briefs throughout the year, looking at the data, looking at how transmission is occurring on our campus, and really looking for the best ways to reduce the spread while allowing all of us to get back to our core business of education and research. The Orange County Healthcare Agency, or Orange County Healthcare Agency, OCHCA, we have actually entered into a memorandum of understanding with them to coordinate our activities. All of our contact tracers are authorized through that MOU to do contact tracing and to collect the confidential information necessary to do the contact tracing. We will be talking, as I said, likely daily with the county as we do our investigations. We'll be focusing on the case and the close contacts to the case. That's really the population that we're focusing on, and really focusing on the exposures that may have occurred among UCI students, staff, and faculty, and household contacts and exposures that are taking place on UCI property. The County of Orange will continue to follow up using their usual protocols on community exposures that may have occurred and are part of the ongoing process for control of COVID-19 throughout Orange County. Next slide. So some assumptions as we think about moving forward. Obviously, the daily symptom checker is critical. It's one of our frontline tools to identify if you have symptoms and have you stay home if you're sick while you receive consultation from COEH and possible COVID-19 testing. Our goal is to run any COVID-19 testing that is a result of symptomatic employees being identified through the symptom checker through UCI Health, regardless of insurance status and not at a cost to employees, so that we can get that early identification and rapid result back so that we can take action. That positive test result will be reported to the contact tracing team so we can initiate contact tracing. We will be in coordination with COEH and HR as necessary, and ongoing frequent communication through the Vice Chancellor of Health Services COVID Advisory Group and other senior leadership here at the university to continue really to evolve and respond to the pandemic and how it's playing out here on campus based on what we're seeing on campus. And I think what's really important to stress here is that we are all in this together. It takes every one of us doing our part in order to create an environment that's safer for us to be able to reopen over time. So making the call when you know you're COVID positive or think you have symptoms, taking the call when the contact tracers call you, and being honest and sharing the information that we need to know to control the spread. And then wearing your face coverings when you're out in public and when you're in university controlled space, washing your hands, really just doing your part to help us all keep our community safe and healthy. With that, I'll conclude. Thank you.
Well, thank you so much, David, for giving that presentation. We really appreciated you giving all that information. So for any audience members who have questions, please feel free to drop those in the Q&A feature. But I'll start with a question here that I had. So we've talked, I mean, you talked all about contact tracing, but can you tell us a little bit about the difference between what happens if you are a case, someone who has COVID-19, or if you are a contact of someone else? What's the difference in those two procedures?
Sure, that's a very good question. So if you are somebody who is COVID positive, we are going to instruct you, obviously, to continue to seek healthcare with your healthcare provider. But we will be instructing you to isolate, which essentially means getting yourself in a place where you are removed from other individuals as best as possible. If you're in a household with other people, getting you in a room separated from the rest of the people in your household. And we will ask you to isolate for at least 10 days from when your symptoms occurred. And then we're going to be wanting to watch to see that you've had no fever for 24 hours and that your symptoms have been improving. And through your physician and our return to work processes, we would then clear you for returning to work. If you are somebody who's a close contact, so you're not a COVID-19 case, but you were a close contact to a COVID-19 case, we're going to be asking you to quarantine for 14 days. That means essentially the same thing in terms of staying home, ideally in a room isolated from anybody else in your household, or if you live alone, obviously staying home alone, not going out for anything but essential medical care, and really monitoring your signs and symptoms for that 14-day period. And we will be asking you to get a COVID test at around day 7 to see if you were possibly infected. But a 14-day quarantine and then coordination through HR and COEH for return to work.
Great, thank you, David. Well, we have a question here that came through the Q&A. So what if someone is reluctant to share their contact history?
We surely appreciate that. Obviously, sharing information and sharing contact information can be difficult, and you may have reasons for not wanting to share. All I can say to you is, in order for us to be successful and to stop the spread of COVID-19, to prevent people from becoming ill, from spreading it to others who are more vulnerable in our community, who may be more susceptible to more serious outcomes, including death, it's going to be just imperative for you to share the information as best you can. Know that we will be treating that information confidentially. We will not be sharing with your contacts who it was they were exposed to. Our goal really is to protect the confidentiality of cases and to use the information to protect the health and safety of our community. So I would just implore people to really be as open and honest with us as you can, because our efforts at contact tracing and getting people into isolation and quarantine are only as good as the information we get from our interview with our cases.
Great, thank you for that information. So we have another question here in the Q&A. Someone is asking, as students are coming back to campus, are we staffed up with contact tracers? What's the status of that?
We are staffing up and ready to do contact tracing over the summer. About 100 graduate students, DTEI fellows, were trained, and we are onboarding them as we speak to be available to serve as contact tracers for us. We're bringing on some additional workforce as well. As I mentioned, we have hired one contact tracing manager and in the process of hiring another. So we are building our capacity and are ready for the students to return.
Great, thank you for that. Well, if anyone else has any other questions, please put those in the Q&A feature. If not, I'll end with this one here. So recently, the UCI started doing asymptomatic testing for students, and they're getting tested weekly. Are there similar plans to do something similar with staff and faculty?
That's a good question. So yes, we've started doing asymptomatic testing with students who are currently residing on campus. We'll be testing students as they move into residence halls, and then looking at testing our student population on campus on a weekly basis when the quarter starts. We're working with leadership to explore expanding our asymptomatic testing to potentially some subset of students who live off campus, as well as to some set of faculty and staff. Really, the goal of this testing is all about surveillance to understand what's going on our campus and to be able to take those steps through contact tracing, case investigation to break the chain of infection and control the spread of COVID-19 at UCI.
All right. Well, thank you for that. And thank you, David, for answering all those questions. And thank you as well to Bob for joining us today and presenting on this episode of Anteater Insider Live. That's all for today. We'll be sharing the recording of this on YouTube, so make sure to check that out. And we'll also have another episode in 2 weeks. So look for the official announcement about that to come out in your inboxes soon. And until then, stay safe.